Fix this. Can she hear me?
Everyone can hear you now.
Oh, yeah. Okay. Hello and welcome everyone for another episode of Khan Clinics. I'm your host, Dr. Amir Khan, presenting from American Muslim Today platform. We're today going to be discussing a topic that is really underdiagnosed. Considering millions of people have the pathology, lots of people snore, many people wake up unfresh. It is so underdiagnosed. Yes, obstructive sleep apnea, a pathology that is very, very prevalent in people who don't sleep well. Lots of issues. Sleeping, snoring, waking up, you name it. And as a result, costs the economy billions of dollars. So where do we stand today? We got two brilliant guests for you, today with me. Dr. Sufia Awan, an MBBS, and Dr. Fatima Tuz Zehra, also an MBBS. Both are MD doctors and are now practicing sleep medicine and helping out at Texas Sleep Medicine clinics. So first of all, welcome Dr. Sufia Awan and Fatima Tuz Zehra.
Thank you, Dr. Khan, for the introduction. Good afternoon, everyone. My name is Dr. Sufia Awan, and I'm here with my partner.
And your partner is Dr. Fatima. So Fatima is trying to...
So today we will
Go on, Doctor, go on.
be talking about...
Let's start.
So today
Let's start.
Okay. So today we're talking about a very critical health issue which, despite of its high prevalence, still remain very undiagnosed and underdiagnosed. Today we're going to talk about obstructive sleep apnea. I will be trying to define sleep apnea and try to explore the impact of obesity, oxygen desaturation, and heart rate fluctuations that can happen in patients that are suffering from sleep apnea. And then Dr. Fatima will be trying to explore and tell us how to treat the obstructive sleep apnea.
Fantastic. I think that would be good. We can break it up into two parts. First part will be more like going over why is sleep apnea important. And then the second part will be more about Dr. Zehra explaining us how can we treat it and what are the treatment options. I think we got two brilliant videos. We're going to start with Dr. Sufia giving us a little bit of an overview, and then we'll play the first video. So go on, Dr.
Sure.
Sufia.
So sleep apnea is actually a sleep disorder where breathing repeatedly stops and then starts during the sleep. It has many types, including obstructive sleep apnea, central sleep apnea, and a mixed sleep apnea. The most common type is obstructive sleep apnea, in which there is repeated interruptions in your breathing during sleep due to partial or complete obstruction of the airway. It is a very common disorder affecting millions of people globally. There is an estimate that about 22 million Americans suffer from sleep apnea, with 80% of moderate and severe OSA cases that remains undiagnosed.
Wow, that's a lot. That's a lot of people being affected by it. So you mentioned that the airway is affected by this breathing. That means that your oxygen cannot get back from your throat inside your body. Tell us a little bit more about that, Dr. Awan. How does that affect us? And why is it important? If we snore, so what? People say, I'm still alive. So tell us a little bit more.
So when you have obstruction in your upper airway there are interruptions, these interruptions are actually known as apneas. They can occur from few seconds to over a minute, and sometimes even multiple times over an hour. They are in turn going to disrupt your normal sleep patterns. They're going to cause disruption in your normal oxygen saturation levels, leading to desaturations, and then they're also going to fluctuate your heart rate. In the next slides and in the video that we are going to show, we will be highlighting on how it does that and why it is important to know about it and treat it.
Excellent. All right, we'll have Jeremy and see you help us put the video on.
Welcome. Today we're diving into the world of sleep apnea, a condition affecting millions globally. Our focus will be on defining sleep apnea and exploring its impacts on oxygen desaturation and heart rate. Obstructive sleep apnea, or OSA, is a serious disorder where breathing repeatedly stops and starts during sleep. These interruptions, or apneas, are caused by a partial or complete obstruction of the upper airway. Did you know that about 22 million Americans suffer from sleep apnea, with 80% of moderate and severe cases undiagnosed? In 2024, a study found that 23% of young adults in Asia and Australia have OSA, compared to 9% in Europe and 13% in the Americas. Despite its high prevalence, many remain unaware they have OSA due to easily overlooked symptoms. Symptoms include snoring, morning headaches, waking up unrefreshed, and daytime sleepiness. The stop-bang criteria: snoring, tiredness, observed apnea, blood pressure, BMI over 35, age over 50, neck size over 40 centimeters, and male gender are key indicators. Obesity is a major risk factor for OSA. Excess fat around the neck narrows the airway, increasing the likelihood of obstruction during sleep. Globally, with rising obesity rates, over 40% of adults in the U.S. are obese. OSA incidence is also on the rise, making it a critical public health issue. Fat deposits in the neck and increased abdominal fat reduce lung volume and add pressure on the airway. Obesity-related inflammation affects muscle function, contributing to airway collapse. Significant fat infiltration in the tongue can also cause airway obstruction. Oxygen desaturation has a great impact on our sleep and play a great role in sleep apnea. Normal blood oxygen levels range from 95 to 100%, but during apnea they drop below 90%, disrupting sleep and potentially causing long-term health issues. Apnea episodes cause bradycardia, a slowing of the heart rate due to reduced oxygen levels. Upon resumption of breathing, tachycardia occurs, with the heart rate spiking to reoxygenate the body. These fluctuations increase cardiac workload and risk of arrhythmias and chronic heart conditions. Over time, the strain on the cardiovascular system from these heart rate fluctuations can lead to severe health problems, including stroke, myocardial infarction, hypertension, and chest pain. In conclusion, the interplay between obesity, sleep apnea, oxygen desaturation, and heart rate fluctuations presents a multifaceted health challenge. Each component exacerbates the others, leading to a significant cumulative effect on overall health. Understanding sleep apnea and its impacts is crucial in addressing this widespread and often undiagnosed condition. Thank you for watching. This video is brought to you by Khan Klinics and powered by American Muslim Today.
No, that was, Dr. Sufia, was quite a nice video. I think it couldn't be any more descriptive and brilliantly done. I think the team of AMT have done a fantastic job there, just illustrating how beautifully the first question that everyone are asking is how could snoring affect anyone? And I think you've shown it there quite nicely. There's a relationship between the back of the throat, the oxygen not getting to the heart, the oxygen not getting to the body first, then the heart, and then the brain.
So now that we have an overview of what obstructive sleep apnea is and what major consequences this oxygen desaturation and heart rate fluctuation with excess body weight can have on a person and make it more prone to obstructive sleep apnea, I would like to explain it a little bit so that it can remove the confusions or doubts that can arise in our viewers, in our audience's mind.
Please.
So it was mentioned in the video that there are a few stages of obstructive sleep apnea that help us diagnose first and then to treat them properly according to their stages. So there are three stages of obstructive sleep apnea: mild, moderate, and severe. This depends upon the level of AHI. AHI is actually apnea hypopnea index that quantifies the severity of sleep apnea by counting the number of apneas or hypopneas, or in simple language, the number of times you stop breathing in your sleep. If the number ranges from 5 to 15, it is regarded as mild obstructive sleep apnea. If the number is from 15 to 30, it is regarded as moderate obstructive sleep apnea. And above 30, if the EHI level is above 30, it is regarded as severe obstructive sleep apnea.
So this is 30 times per hour
Hour,
you stop breathing.
yes.
Okay, excellent. So above 30 is very severe, and then below that it could be mild or moderate, right?
Yes.
Beautiful. Okay, very nice.
So now we're going to discuss about the features of obstructive sleep apnea. So the most important feature that we see in patients is snoring and then witness apneas or interruptions in your sleep. Both of these features, they are noticed by not the person who is experiencing them, but their partners or their guardians. So normally we have seen that most of the patients, like if their husbands they are snoring or their wives they're snoring, their partner they bring them to our clinics that this person snore a lot or stop breathing or wake up with a feeling of choking or gasping from their sleep. With
So,
this,
so if you see someone who is at the night sleeping, but not just, and one they're snoring or they may not snore, but their breathing should be normal. Their and breathing meaning their inspiration expiration is normal. And if they are not doing that, we should get concerned about that, right?
yes.
Gotcha. Okay.
With this, obstructive sleep apnea can manifest itself through other symptoms like morning headaches, daytime fatigue, and waking up unrefreshed from your sleep. There is a particular criteria that was also mentioned in the video that was shown before. That is the stop bang criteria.
Very nice.
It is it is a criteria that help the physicians characterize and diagnose sleep apnea and to differentiate from other health issues. So S for snoring, T for tiredness, O for observed apneas, P is going to be for high blood pressure. So the patients who have high blood pressures, they're more prone to OSA. Then B is going to be BMI over 35. So this is very important. So all the people who are obese, they are more prone to OSA. I'm going to be discussing that afterwards as well. Then age above over 50 years, large neck size because that increases the parapharyngeal neck fat pad, and then the gender male. So
Very
stop
nice.
bang criteria is very important in diagnosing the patients with OSA.
So these stop bang 8 criterias are the ones that you look out for, and that those
Yes.
could, if they are abnormal, the risks quadruple. They become even more, and I think that's what you're saying is that we look out for not just snoring, but if that's combined with the BMI, i.e., the weight being high, you got to be on the lookout more. It's more damaging. Is that what she's saying? Very brilliant,
Yes.
Dr. Awan. So keep going. Please explain a little bit more to our
So
audience.
So one of the most thing that plays as a major risk factor for sleep apnea is excess body weight. A 10% increase in body weight can raise the risk of OSA by six-fold. And
Wow.
over the time, increased body weight increase the risk for sleep apnea progression, and it actually make it harder to treat the patient as well. Over 40% of adults in US, they are considered obese. So that as the incidence of obstructive sleep apnea is increasing because the incidence of being obese is also increasing.
So good
And with
question.
this, the cycle of a
Good point, and I probably want to throw this out for the audience to think about it. And a lot of times we think that obese kids is a good thing, and as we will explain this later on in a separate episode, it's obesity is never good, whether you are young, whether you are old, or whether you're in your prime. So just just throw that out, and if it's a lot of population that's nowadays eating out, not watching their weight, it's an issue, and it starts from here. Okay.
So, with this, if the patient is obese, they are more prone to OSA. Yes, we get this point. But if they have OSA, this is also going to make weight loss journey a little bit difficult for the person. So it actually makes the whole both things correlated to each other and making it a critical public health issue as well.
Okay.
So here we can see how fat deposits in the neck can contribute towards sleep apnea because they narrow the airway, making it easier for the patient to have an obstruction during their sleep. In the second picture, we can see that as the patient is getting more fat around their neck, there are more chances of getting obstruction in their neck as compared to the first picture that we have here, in which a normal patient is sleeping who is not having any kind of obstructions during their sleep.
Very nice. So you're showing that the part of the tongue or part of the pharynx that goes down at the back, if the airway line is not clean, the oxygen is going to get interrupted. So the flow of the oxygen from the back of the mouth all the way down has to be smooth to the lungs. And if there is interruption here and the oxygen is getting interrupted, you have a problem. And I think that's what you were showing earlier. Very nice in the video as well. Very nice.
Similarly, here we can see that in the pharyngeal wall, the increase in the parapharyngeal fat pad and increase in the subcutaneous fat around the neck area can cause airway obstruction. And as the patient has lost some weight, that obstruction has reduced, making it making the person more less prone towards the sleep apnea and obstructive episodes.
Very nice. Okay.
So the next thing that we are going to discuss is about the impact of oxygen desaturation that can occur. Oxygen desaturation refers to a drop in your blood oxygen levels, typically measured as SpO2 levels, which is the peripheral capillary oxygen saturation. So during apnea episodes, as your airway is blocked, it prevents the oxygen from entering the lungs, that ultimately leads to decrease in oxygen levels. This not only disrupts your sleep, but it actually has a very serious health consequences. In short term, of course, it is going to disrupt your sleep, causing poor sleep quality, morning headaches, daytime fatigue. But in long term, it can increase the risk of hypertension, stroke, MI, and other cardiovascular diseases as well.
Very nice. Okay.
So here in the chart, we can see that during the apnea episode, we can see that the patient's oxygen desaturation is fluctuating a lot and it's going down. That means it is decreasing from the 90 to 95 levels towards 70s level. And this is a very serious risk that comes with obstructive sleep apnea, as the patient is having low oxygen levels that can actually lead to stroke as the patient is getting less oxygen.
This picture I think is one of the beautiful one that you have, Dr. Awan, because not only do you show right there in the green where the oxygen is going down, you're showing underneath how the heart rate has to kick in to compensate. So it's sort of like it's called a sympathetic activation, where you have to kickstart the heart because the oxygen is low to try to get more oxygen off you. And in sleep, you're seeing throughout the night, whenever the oxygen is going down, there is a kick in the heart rate. So the heart is not relaxing. And that's where there is another problem. Yes, you can get the oxygen compensated, and a lot of people for a long period of time do that. But it's at a price. And the price is that sympathetic push or that drive, heart rate drive. So very nice, Dr. Awan. That's just quite nicely shown in your picture.
So as Dr. Khan has discussed about that, whenever the sympathetic stimulation or when you're having low oxygen levels, your heart actually is getting a little bit more workload than before it has to do. So now the next thing that we are going to discuss about is the heart rate fluctuations during the sleep apnea. So bradycardia is actually a condition that is when your heart rate is slowed down during the apnea episodes as compared to the normal one. And then tachycardia is when your heart rate is above the normal levels that actually happen when you resume your breathing. So this bradycardia and tachycardia, when it is consecutively occurring in your sleep rather than having a normal pattern, it is going to increase the cardiac workload. Your heart has to work more, and the risk of developing arrhythmias, that your heart is going to lose its rhythm, the heart rate is going to fluctuate, the rhythm is going to fluctuate, and then it can actually lead to very chronic heart conditions, and then it can lead to atrial fibrillation, heart attack, myocardial infarction, and other cardiovascular issues as well.
Very
So
nice.
in this graph, we can see that the heart rate that should stay between 70 to 100 during your sleep, during an apnea episode, it is having first a lower heart rate, that is bradycardia, and then it is, after resuming, it is going upward more than 100 to show that there is a tachycardia. So when your heart has to fluctuate between these two, it has to do more work, and that actually make it more prone to other diseases of the heart.
Very good.
So now that we know that sleep apnea, what sleep apnea is, what is the implication of obesity, heart rate fluctuations, oxygen saturation, and their relationship, and their how intermingling is there between them, we know that it is very important that we diagnose it as early as possible, and then we need to address the weight management, we need to address the oxygen desaturation and heart rate fluctuation in treating and preventing of this order. Now, I would like my partner, Dr. Fatma, to step in and tell us how can we treat this critical health issue, because that is, I think, our audiences will be waiting for.
Very nice. So before you do that, I want to just add a point, 2 points. One question that came up was, would you only get this if you're lying on your back, supine? And that's question to Dr. Sophia before we move on, because that's just like, oh, I don't sleep on my back. I shouldn't be getting this. So my throat is not blocked. What do you say to that, Dr. Sophia?
No, you can get apneic episode when you're lying prone, you're on your supine. It does not. Yes, in supine we have to see whether it is more or less, but it can be positional, it cannot be positional.
Very good. And when we're going to diagnose sleep apnea before we go on to the treatment, you could do a home sleep study or a home sleep study or an in-lab sleep study. Home sleep studies are generally done for screening purposes. They're not conclusive, they don't see a lot of information, and they can miss information, and they are falsely negative a lot of times. And then an in-lab sleep study will give you a little bit more information, and that's where you will diagnose, you will see actually the oxygen dropping during the night time, and it confirms that you have a problem. So just those 2 points before we bring on to Dr. Fatma. Dr. Sophia, very nice, and thank you very much for explaining that. That was really fantastic. Just the way how you went over stuff, and I'm making a note of other questions that are coming in. We will try to answer them as we go on with after Dr. Fatma's presentation. Dr. Fatma.
Thank you, Dr. Khan, for having me. Hello and good afternoon, everyone. I am Dr. Fatma, and today I will be discussing the importance of positive airway pressure devices, particularly in the treatment of sleep apnea, which Dr. Sufia has very well explained. So today we will cover that what PAP devices are, their different types available, their significance, new advancement in the CPAP therapy, using of PAP devices in children, and finally we will wrap it with conclusion and questions answer session.
Perfect. So before you go on, do explain to us what's a PAP device.
Yeah. So basically, PAP devices are the positive airway pressure devices, and these are the machines that commonly prescribed for treating sleep apnea. And as we all know that obstructive sleep apnea is a sleep disorder characterized by periodic, partial or complete obstruction of the upper way
Mm-hmm.
during sleep.
Gotcha. Just show us your slide a little bit enlarged. Probably you can put it in a slide presentation. We can see it even bigger. But we got your point.
Uh,
We get your first point. We understand what you're saying. What are PAP devices? PAP is, like you're saying, is giving positive pressure. Positive pressure means
Yes.
we're giving pressure to the patient so the airway can remain open. That's positive pressure. It's not negative pressure. Negative means when you suck out pressure, but here you're giving pressure just enough so that the airway can remain open. So very nice. Okay.
Yeah. And it prevents the airway from the collapsing.
Yeah. I think if your slide is in PowerPoint, we'll probably see it better, right? Is that right, Jeremy? Okay. Fatma, see if you could do that. Okay.
Okay. So next is the type of PAP devices. The most common PAP devices are the continuous positive airway pressure, commonly known as CPAP. Another type is automatic continuous airway pressure, known as APAP. Next is the bilevel positive airway pressure, known as BiPAP. And the next one is bilevel positive airway pressure spontaneous time, known as BiPAP ST, and we have average volume assured pressure score, commonly known as AVAPS.
Okay. Very nice.
So next we will be discussing what's the difference between the CPAP and APAP devices. As I have already mentioned that CPAP is the continuous positive airway pressure, and it provides a single set of pressure throughout the sleep. That means air pressure remains constant during both inhalation and exhalation. And the CPAP devices are generally more affordable as compared to other PAP devices.
Very
Whereas
nice.
in APAP, which is automatic positive airway pressure, the machine will adjust pressure according to the body need. Like it will self adjust on a breath by breath basis, and it's generally more comfortable for a new users.
Very good. Fatma, could you show a PowerPoint presentation like your slide? Just run it as a slideshow because the computer is
Sir, I am sharing it is a slideshow.
okay. Okay, perhaps it's just how we're seeing it because your screen has become smaller. That's fine. Keep going. Good. You can keep going.
Okay. So next we will be discussing about what are the PAP devices. So BiPAP, as the name indicates that in BiPAP the device has two different pressures, like one
Mm-hmm.
pressure for inhaling and one pressure of exhaling. Like there will be two different sets of pressures, and it's most commonly used in those individuals who can't tolerate a CPAP pressures and have the elevated CO2 levels in their blood. So in the diagram below, we can see that this is the normal breathing, which is without pressure, then the CPAP with sort of higher pressures, and the BiPAP with E pressure, which is exhalatory pressure, and IPAP pressure, which is inhalatory pressures.
Very nice. Okay.
So next we will be discussing about what are the AWAPs and BiPAP SC devices. So AVAPs are the devices which are type of ventilators used for primarily for those patients which have chronic respiratory conditions. And these devices adjust the pressure support automatically to maintain a targeted tidal volume. And what is tidal volume? So tidal volume is basically the amount of air moved into or out of the lungs during each breath.
Mm-hmm. Very nice. Okay.
And AOS is often used in conditions like COPD, neuromuscular diseases, and obesity, hypoventilation syndromes.
So
Whereas the bi
what is the so that brings a very so you just mentioned obesity hyperventilation patients, and obviously these
yeah.
machines are now becoming more and more advanced. What is obesity hyperventilation, and could this be back? Who has obesity and hypoventilate, meaning their breathing even during the day is not enough, and they don't even know it. Tell us a little bit.
So basically, obesity hypoventilation syndrome is a condition that occurs in people who are obese, and it's lead to underlying breathing conditions like hypoventilation. And basically, it is due to when person has an increased CO2 levels in their blood.
So they don't even know themselves that they're not taking deep breaths, and as a result, when they are not taking deep breaths, one issue is they're not getting enough oxygen, but the main other issue is the carbon dioxide, which should normally come out of the airway, they tend to retain that. And when you start having low oxygen, which Dr. Awan was explaining, and on top of that, now you're keeping all the carbon dioxide in your body, which should come out, you have a double problem. And that's what they say, oh, you may have obesity hyperventilation. It is a double problem, and that's why you sometimes need these advanced other machines. And one of the ones that you use is one they call the BPAP. Sometimes we call it BiPAP, but patients like calling it BPAP. They like it like, oh, it's a BPAP machine. It sounds more trendy, more fashionable, BPAP. But basically what the BPAP machine is doing is not only giving you the oxygen positive, but also sucking out your carbon dioxide. It helps to get the carbon dioxide out. So that's where Dr. Awan was talking about, oh, what is obesity hyperventilation? Obesity, you're obese, hyperventilation, you're not taking deep breaths enough to exhale out the carbon dioxide. So very nice.
Yeah. And within BiPAP ST, it works almost same as of the BiPAP. Like in this machine, there is different inhalation and exhalation pressure, but there is one extra feature with ST mode, which is called as spontaneous time. So it adds a backup rate to the patient's respiratory condition.
Okay, very nice.
So in addition to the PAP devices, there has been some exciting advancement in the obstructive sleep apnea treatment. For example, oral appliances like mandibular advancement devices, and it helps to keep the upper airway open by repositioning the jaw. So as you can see in the diagram, these are the mandibular advancement devices.
Very nice. So is there not a video that we can play and show a little bit of that, Dr. Fatima? Do you want us to show this now?
Yes, sir. We have a video as well.
Okay, let's have a look at that, and then you can explain the other things to us.
Welcome to our comprehensive guide on positive airway pressure, or PAP devices. If you or someone you know struggles with sleep apnea, this information could be life-changing. Today we'll cover what PAP devices are, their types, significance, new advancements in treatment, their use in children, and conclude with a summary and Q&A. PAP machines are the most commonly prescribed devices for treating sleep apnea disorders. Obstructive sleep apnea, or OSA, is characterized by periodic, partial, or complete obstruction of the upper airway during sleep. There are several types of PAP devices available. Let's explore the main types. Continuous positive airway pressure, or CPAP, provides a single set pressure throughout the night. It's generally more affordable, but may not accommodate changes in your breathing as well. Automatic positive airway pressure, or APAP, adjusts the pressure on a breath-by-breath basis. This can be more comfortable for new users, especially when breathing fluctuates. Bilevel positive airway pressure, or BiPAP, has two pressure settings, one for inhaling and a lower pressure for exhaling. It's used for individuals who cannot tolerate CPAP machines or have elevated carbon dioxide levels in their blood. Let's compare CPAP and APAP devices. CPAP provides a constant set pressure during inhale, while APAP adjusts pressure based on your breathing needs, offering more comfort for new users. Let's explore some of the new advancements in OSA treatment. These include oral appliances like mandibular advancement devices, Inspire therapy involving hypoglossal nerve stimulation, surgical options such as genioglossus advancement, and positional therapy. Mandibular advancement devices help reposition the jaw to keep the airway open. Inspire therapy stimulates the hypoglossal nerve, helping to keep the airway open by moving the tongue forward. Genioglossus advancement surgery repositions the tongue muscle attachment to prevent airway collapse. Positional therapy encourages sleeping in positions that reduce the likelihood of airway obstruction. PAP devices are also used for children with obstructive sleep apnea. They improve sleep quality, cognitive and behavioral functions, and even aid in growth and development. PAP therapy keeps the airway open during sleep, preventing interruptions in breathing that can lead to fragmented sleep and decreased oxygen levels. Consistent use of a PAP device reduces the risk of complications associated with untreated sleep apnea, such as cardiovascular issues, daytime fatigue, and cognitive impairments. Thank you for joining us in understanding PAP devices. Remember, a good night's sleep is essential for a healthy, productive life. If you think a PAP device could help you or a loved one, consult with your healthcare provider. This video is brought to you by Khan Klinics and powered by American Muslim Today.
Are we back live? Okay, that was very, very informative. I must, before we proceed, again powered by American Muslim AMT team, American Muslim today doing it for Khan Clinics, and they just made a fabulous sort of video and graphic presentation that was really nice. Explains a lot of what Fatma's point was. And I'm glad they also put one of the slides that I liked about it where they say that the kids may need PAP therapy. It's not necessary, but kids may also have obstructive sleep apnea. And you have to watch out when they are snoring. And snoring compound with the fact that they're having irritability, which is common. Their growth curve, if that starts getting affected, you have to have that evaluated. And their tonsils is another big player, which we'll talk about one of the next lecture series. It will talk about that. So it's I'm glad you put that in, Fatma. So very nice, and quite a brilliant job. So please continue. What you got a bit more information to discuss with us?
Yes, sir. So as we have already seen in the video about the inspired therapy and genioglottal therapy, so let me explain a little bit about the inspired therapy. So basically it involves the hypoglossal nerve, which is a cranial nerve 12, to stimulate and maintain the airway patency.
Okay, very nice.
And in the surgical options such as genioglottal advancement, and we have also the positional therapies are also available to treat obstructive sleep apnea. And here is a short clip on the inspired sleep apnea innovation. Let's take a look.
Okay. Can't hear it. I think we have voice issues with it, Sophia. We can't hear the voice.
So I'm not playing the voice.
That's okay. So just walk us a little bit through what's the Inspire, Fatma, while the video is being played at the back. That's fine.
Yeah, so basically Inspire is a surgically implanted device that stimulates the hypoglossal nerve. As we all know that hypoglossal nerve, it controls the tongue function and it helps to keeping the airway open during the sleep.
Very nice. We know for sure, and we were part of the Inspire trial, and for sure it helps in mild, moderate cases. It's the severe and very severe cases that they were doing a study on and trying to see if there were any benefits with that. But the mild cases are definitely helped. Okay, very nice. Let's continue seeing that sort of like helps as well. So it's just that there are other options available. People sometimes get frustrated and with the PAP device, and it can be very frustrating, honestly. But
Yes. Yes. So in the genio neurostimulation system, a small neurostimulator is inserted under the chin to deliver the electric impulses to the hypoglossal nerve.
mhm.
And here's a short video as well to understand how it works.
So you may have to talk us through that if the voice doesn't come up. Please just explain it a little to us.
Yes, so basically in genio neurostimulation, a neurotransmitter will be inserted under the chin
Hmm.
and it will deliver, or you can say it will impart the electric impulses to the hypoglossal nerve, as all you can see that neurostimulator inserted in the chin and it delivering the electric impulses to the hypoglossal nerve, and it works and it helps in keeping the airway open.
Very nice. Okay.
So next we will be discussing about the benefits of using PAP therapy. Like PAP therapy helps to improve the sleep quality, it enhances the energy level, it improves the quality of life, and it reduces the risk of health complications such as heart disease, stroke, diabetes, and high blood pressure. So as you know,
Nice.
like how beneficial it is to use the PAP devices for sleep apnea.
Okay. Very nice.
So, so besides its use in adults, PAP therapy is also important for children with sleep apnea. It's not in only improve the sleep quality, but it also provides a cognitive and behavioral benefit. And it also helps to manage the conditions like Down syndrome and support in growth and development of the children.
So especially look out. The important thing, if your kids are snoring plus have growth and development delays, that's one of the big ones. You got to look at and the quality of sleep. You shouldn't see your kids suffering, anxious, kicking, fighting in his or her sleep, and that's very important. Look out for those points. Very nice. That's very important. Dr. Fatma. Hmm.
Yes, sir. Thank you. So, in last, we can conclude it or summarize our today discussion as that like PAP therapy keeps the airway open during sleep, preventing interruptions in breathing that can lead to fragmented sleep and decreased oxygen levels. And the consistent use of PAP devices reduce the risk of complications associated with untreated sleep apnea, such as cardiovascular issues, daytime fatigue, and cognitive impairments.
Excellent, excellent, excellent. This, I think you both ladies have done a sort of like a marvelous job, and you couldn't have explained it any better than your presentations and your videos with that, and why is it important? Why is it important not for just elderly people or young and for young and for teens? And why is that relevant? That you have to make sure that you're sleeping well, and that goes with all of the other issues that are going on. I, I I have got to say and remind everyone one before we leave. I want to thank the production team. It's almost an hour, so we're gonna have to let you guys leave. And I think it's been such a nice session. We all sort of being together. And as Hamza Bhai has pointed out, please make sure that you like and subscribe, and you make sure that there is that you share these videos as well. And Jeremy has put up one of the talks that is going to happen next week, and we have Dr. James Hollis here, and Dr. Hollis has wrote a lot of books, and not only that, he's wrote some books. He will be discussing some interesting, very interesting topic. He has a big following, and we're gonna have a very excellent session next week as well. So we're excited to gonna have Dr. James Hollis. I want you to all sort of like come prepared and opt in to ask questions to him. He's end of finding meaning in life, second life, life hereafter. He's done a lot of research on this, and we'll share some link, and so you guys can have a look at this and come in with your part and play a role in sort of like making it more conducive. So it's next Friday, August 16th, and in PAK time is 1 a.m. obviously. So Rida, thank you for bringing, and the social media team, in fact, bringing that up and have that discussion. So on that topic, we're sort of gonna like leave. We appreciate all of you sort of like attending the session. I gotta reiterate this is only, the team does it because to get you informed. So don't forget to like it, don't forget to contribute. And those who are sort of like inactive, you guys can sort of be a little bit more active and sort of like get involved in this a little bit more. But meanwhile, we appreciate all of your efforts here and at work. We hope that you get a good weekend and have some good rest. We'll hopefully see you next Friday again. From here and the studios, the team, social media, Jeremy and CU and everyone else, goodbye.